So this is the Seeking Amyloidosis Very Early trial, also known as, we call it the SAVE trial. And it's really an attempt to identify patients who have a known diagnosis of monoclonal gammopathy of undetermined significance, or MGUS, or they have smoldering myeloma. And this is really looking at those patients when they do a marrow for standard of care purposes, can we then take a sample of that marrow and actually sequence their light chains? There are some patients who, in terms of the light chain repertoire, that there is some association with some of certain light chains with the formation of systemic light chain amyloidosis. So we will then return back to the patient and the provider whether or not they carry one of those light chains associated with the formation of amyloidosis. And our hope is that that provider will then go ahead and do a bit more of a workup, for example, do a 24-hour urine for total protein, looking for proteinuria, check cardiac biomarkers, NT-proBNP and troponin, and perhaps do a fat pad biopsy, really looking for amyloidosis. And the idea is, can we catch these patients early, so again, so that they don't present with advanced stages of the disease. So far, we have actually caught patients. I'm not going to share with you exactly how many, but we know that the trial is enrolling very nicely. We have definitely caught patients early on in the disease, and I think at a future meeting, there'll be some preliminary results about the study.